is prioritizing mental health care all across New York State.
She has a $1 billion multi-year plan to address some unmet needs of New Yorkers. News Channel 9's Iris St. Moran joins us now to tell us just how that $1 billion will be utilized. It's a lot of money.
It is a lot of money, and the plans for the $1 billion stretches far. It will be used to increase inpatient beds and to expand school-based mental health services. Part of Governor Kathy Hochul's $1 billion plan to improve mental health care will be focused on schools. She is proposing $10 million in grants for suicide prevention programs targeting at-risk youth and $10 million to expand school-based mental health services.
Kids who don't get help, it puts them at a disadvantage in the classroom and beyond, and it sets them up for failure. So our children need preventative services now to stop them from needing intensive services later.
The governor says since the pandemic, more than 1 in 3 New Yorkers have sought out mental health services. But there have been barriers, including getting appointments, long waits, and insurance may not cover. Another barrier is not enough inpatient beds, so funding will help to add 1,000.
By funding 150 beds at state facilities and bring 850 psych beds back online in hospitals.
Another issue she addressed is opioid addiction and how prevalent fentanyl is. So she is proposing expanding access to fentanyl test strips, so giving people the ability to test their drugs before using.
That seems pretty extreme, but I believe it'll save lives. I believe we have to take that step to let them test. We have to spend the money, get the test kits out.
Now back to mental health care. Hochul says she's proposing legislation to stop insurance agencies from denying access to mental health services for both adults and children. Jeff.